Good day. I have a question for Dr. Henry. The restart plan, as I read it, the key data that you're quoting in there is first dose vaccination. So when you talk about 60% or 65% or 70%, I wanted to ask you about this story out of Public Health England regarding the B16172 variant, which is more transmissible. As I understand the study, as it's been reported, it says the Pfizer vaccine offers high protection, 88% against that variant, providing it's both doses, 2 doses. Given the low number of second doses here in BC, does that give you any pause about us basing our restart plan on first doses when that UK study suggests before you can be protected against the B1617.2, you need 2 doses?
Yeah, so obviously the different strains of the virus are something we watch really carefully, and that information is posted on the BC CDC website. As you know, we've had, I think we're up to about 500 people who've been infected with one of those strains. So yes, it of course concerns us. We're watching that carefully, but we also need to know that the measures we take to reduce transmission work against all of these variants of concern, all of the strains that are circulating in our community. So the decreasing case rates and the importance of taking those preventive measures right now more than ever continue to be part of the plan. And that's why we're going slowly. So yes, for all strains, having 2 doses gives us greater personal protection. But more importantly is the overall protection we have in the community. And we've shown that for all strains, all transmission, having everybody with a single dose is the most important single factor to get us to reducing community transmission overall. And then we need to boost everybody's individual protection with the second dose, starting with those who are more likely to have severe illness or death from COVID-19. And we are moving up the second dose for everybody, but particularly for people who are older, people who are have immune compromising conditions, people who are on a clinically extremely vulnerable list. And that is happening later this week as we're able to get more vaccine in and getting people moved up on those lists. So it is a combination of those things. It's not one or the other, but we do look at the data overall, and yes, we believe that having that minimum level of protection in adults in the province is the one single factor accompanying with all of the other data that we're using that will help us remove those restrictions that are most severely impacting us both socially and in the economic sense. So it is absolutely, again, finding that balance and paying attention to all of the different variables. And that's why I say it's not going to be by dates, it's going to be by data that's helping us make sure that we're doing the right thing. So if we start to see, for example, in the next few weeks that cases are increasing for some specific reason, and we need to get more dose 2s in before we move to the next step, then we'll slow down our process, and we're doing that. But I think we are confident from a public health perspective that we have the tools in place right now that will safely get us through this next few weeks and months.